At the end of the day, only 6 people were able to select and get approved for healthcare. 6 people. Not 60,000. 6.
And despite the numerous red flags and lack of testing, they assured us that all systems were a go.
I am as frustrated and angry as anyone with the flawed launch of Heathcare.gov.
The new website where people can apply for health insurance and browse and buy affordable plans in most states hasn't worked as smoothly as it was supposed to work.
As far as the size and the scale and the complexity of this, of Healthcare.gov and the Affordable Care Act, I don't think the federal government had probably ever taken on such a large, complex effort in such a compressed time frame ever in its history.
It must be big.
That's it. Yeah!
There's 3.5 years between the time that the law was passed, March 23rd, 2010, and when the first enrollment period opened, which was October 1st, 2013. During that time, there was a lot of uncertainty in almost every aspect of the project. The federal government generally did not have a really good understanding or a handle on exactly how complex this implementation was going to be. They had been running these large programs with massive IT infrastructure needs, so this was one more that was like that.
The troubled launch of the federal health insurance website again captured attention on Capitol Hill.
The site has had serious problems.
Who is in charge, Madam Secretary?
The person now in charge as an integrator is QSSI, one of our...
Who was in charge as it was
CMS
being
team
built?
Was in charge up till...
At that team, who is the individual?
Michelle Snyder is the...
Michelle Snyder is the one responsible for this debacle.
Well, excuse me, Congresswoman, Michelle Snyder is not responsible for the debacle. Hold me accountable for the debacle.
Okay.
I'm responsible.
Thank you. I yield back.
It started out as one office within the Department of Health and Human Services. They didn't do it alone. There was a lot of White House involvement.
Let me remind everybody that the Affordable Care Act is not just a website. It's much more.
This was President Obama's signature piece of legislation, and the White House needed to make sure that this project went well. Over the course of the year, they realized that they didn't have the expertise, the resources, or the funding that they needed to do what needed to be done. They didn't prioritize. They didn't manage the risks, the amount of coordination that was involved, the amount of policy that was required, and the level of technology and integration.
If you just walk in as an engineer and walk in and look at a bunch of other engineers and see what they're doing and how they're doing it, and it was just total insanity, like
staggering. There was a lot of federal agencies, many federal agencies involved.
There were 55 different companies contracted to work on different parts of Healthcare.gov.
5 government agencies, 36 states, and more than 300 insurers with more than 4,500 insurance plans, all coming together in Healthcare.gov.
Right now, there's no central technology authority inside of the federal government. That doesn't exist.
The government reserved for itself the job of coordinating how all this was going to go, and the problem was the government doesn't really have that skill set.
There was a lot of risk and a lot of uncertainty about how much participation was going to occur. And yet, they buy physical infrastructure and data centers as opposed to using the cloud.
Bureaus of the U.S. government, all of whom act as if they've never heard of each other before. They're in dozens of different buildings. And not only did they not have any kind of habit or custom of working together, they were in most cases explicitly forbidden from communicating with each other because of the way contracts are managed through the government.
So there were real physical barriers. People that are involved in Heathcare.gov spread out all over the DC metro area. My kids are in the other room, and I text them when they're in their bedroom, as opposed to walking up the stairs or hollering at them. There were multiple vendors that were involved, and they didn't, until very, very late, put all of the pieces together. They didn't have the visibility that they needed, either in terms of progress or quality. By some accounts, they started to get inklings of that in a real way in the summer of 2013, right before October 1. You know, you're within 2 months of a live release and you're still not seeing the system work end to end. How do you uncover errors or problems or risks? And so panic ensues.
What's the standard protocol? What's the recommended industry standard for end-to-end tests before rolling up a major website like this?
A burning platform, and literally Healthcare.gov was a burning platform, created a lot of impetus for change. People tend to get very receptive to change in the middle of a crisis.
The truth is that this is, number one, very complicated. The website itself is doing a lot of stuff.
The leaders who were involved in Healthcare.gov made a huge push for fixing the problems.
We've got people working overtime, 24/7, to boost capacity.
And that meant filling key leadership positions that had remained vacant. And it also involved bringing in an ad hoc technology team of experts from the private sector.
The U.S. Digital Service started when Healthcare.gov went down, caught on fire, the website was spinning shrapnel everywhere. They'd turn on CNN to see whether the website was back up. We're supposed to come in, bring in skills from the tech industry, make systems work better inside government, and then head back out again.
So one of the changes that they made, create an exchange operations center. The second thing that they did, they went to a badgeless, titleless culture. It doesn't matter where you're from or who you were employed by or what your title is. You're here to get this site back up and running and stable.
It was like the battlefield medicine that helped a lot in a very short period of time, was stuff that seems silly to even explain now, such as having all those people meet together, like sometimes.
Best practices like let's get everybody in a room, try to do a blameless postmortem, quality engineering practices, those kinds of things. Like that was what allowed Healthcare.gov to make it through the enrollment period.
And so it was very mission oriented, it was very focused, and it was not political. It was really about creating teams of people who had a singular focus on getting the site back up and running. So all of those things, they were following those principles of agility. So in that first day of that first enrollment period, October 1st, 2013, they had 6 people that were able to sign up for a plan. The first day of the second enrollment period, just over a year later, they had 60,000.
And so after that, people said, you know, we need more technologists in government. But But I gotta say, like, working at the U.S. Digital Service, often hard, often difficult, often frustrating, off the charts meaningful. Like, there's a lot of people who say happiness is not this hedonism kind of, did you enjoy your day and how much candy did you eat?
Yeah.
It's like, did you work on something that you're going to feel good about, on your deathbed kind of stuff?